afternoon, Dr. Hanlie, and thank you for joining us on this short interview. Won't you please tell us a little bit about yourself and your background?
Good afternoon, Busi, and thank you for this opportunity, and thank you for everyone else listening. My name is Hanlie Snyman. I'm a medical doctor, and I've been working for RX Health for almost 9 years now. I'm mainly responsible for consultancy work, where we have to look at high-cost cases as well as pre-authorizations for surgery. My passions, apart from my husband and my children and my life and sport, in medicine are chronic diseases, especially diabetes care, asthma, as well as hypertension. I also had a travel clinic, so I'm an avid traveler, but I'm also very interested in immunizations and how to keep people safe by preventative measures. All of this cannot always apply to the work I'm doing here, but this year especially, we've realized having knowledge of immunization and how to protect people and how to be proactive actually came in quite handy.
I can quite imagine that. So now talking about immunization, can you tell us if you have been vaccinated for COVID-19?
Yes, I'm definitely positive. I've been immunized. I was part of the group of doctors who were immunized by the Sisonke trial, and we were immunized in February this year. We all received the J&J immunization. And I can tell you today that I'm extremely grateful as well as relieved for that life-changing intervention.
Okay. There are currently a lot of debates and opinions about the safety of the vaccine. And there's, talks about it possibly changing our DNA. Is there any truth in this? Can you explain that to us so we understand a little bit how that works?
Yes. So firstly, I want to tell you that this vaccine gets a thumbs up. Yes, it is safe to use. Let's start to say that COVID-19, the infectious disease, is caused by a coronavirus. We also say it by its other name, SARS-CoV-2, and most people will name it COVID-19. So this is such an interesting time because people know about the messenger RNA vaccine, or for short mRNA vaccine, and it is manufactured by Pfizer, and it works differently than other vaccines that we know of. This type of vaccine is new, but what's important to understand is that the research into this vaccine has been coming for decades, and the development of this has been many times investigated also for other type of viral infections, and for example, vaccines against Zika virus, rabies, and flu. So this is not really a new vaccine. It's maybe new vaccine, but it's not new technology. And the research has been coming for decades. And that's why this technology could be used in a faster than traditional way and in making the vaccine. But it's definitely something that's been coming for a very long time. So what people must understand is, firstly, we know that you get this immunization in the upper arm muscle. Now, we talk about the mRNA or messenger RNA vaccine, but do you understand this is not a live virus that you receive in your body or in the muscle? So it cannot give you COVID-19. What happens is, through this technology, the mRNA, the vaccine, teaches the cells in our bodies to make a harmless piece of spike protein that is unique to this coronavirus. And this is found on the uniqueness of the protein is found on the surface of the virus. And then what happens is after making that protein piece, our bodies, our cells destroy the mRNA. So it's not staying in our bodies. Our bodies then recognize the protein and it shouldn't be there. And we start making T lymphocytes and B lymphocytes that will remember now how to fight this virus, this COVID-19 virus, once we get infected by it in future. There's also another immunization at the moment in South Africa against COVID-19. It is the vector vaccine, the J&J, that happened to be the one that I have received. And this contains a modified version of a different virus than the one that's causing COVID-19 infection. And this one also delivers a very important instruction to our cells to make a unique protein that our immune system will then make T lymphocytes and B lymphocytes against, and this will help to fight the infection in future when we get in contact with this infection. What is really important to understand is, firstly, this is not a live virus that you receive. It cannot give you COVID-19. The other important message here is that this immunization do not affect or even interact with our DNA in any way. The mRNA never enters the nucleus of the cell, which is where our DNA is kept. So it cannot change our DNA because it's not interacting with our DNA. And our own body cells break down and get rid of this mRNA soon after it is finished using the instruction.
That's very comforting to hear because we've heard those rumors going around, and a lot of people are alarmed, and possibly the reason some are hesitant to going to have the vaccine because they're like, I might not be me after all. So something
I
might
think this is really a new technology that we must embrace, and it's really important to understand that the mRNA is not ever affecting or interacting with our own DNA because it's not going into the nucleus. That's a really important fact to know. So all the misinformation about it changing our DNA, it's impossible. It can't do it. It's never going to happen. And also the mRNA is being broken down and getting rid of our own bodies. It's not something that stays in our bodies. Once it's done its job by giving the instruction, our own body will get rid of it.
Okay. Thank you so much for that. Now, let's talk about pregnant women, moms to be, who are so concerned about being vaccinated for themselves and obviously for the little ones that they're carrying. I've also heard some trying to be pregnant have been told, no, don't vaccinate until you've had your baby. Should they be concerned? Is it safe for them to get the vaccine?
Yes, again, it is safe for them to get the COVID-19 vaccine. And I also want to stress, I think it's extremely important for them to get it. So data from small studies and vaccinated pregnant women, meaning women who didn't even know they were pregnant, and other women now have shown us that there is no harmful effects to the pregnant mother or the fetus or the baby. What happens is that once a pregnant mom is immunized, she will then make antibodies. She will also have this T lymphocytes and B lymphocytes being made. And then those maternal antibodies will cross the placenta, and also it will cross into in the breast milk to the baby. And that will actually protect the baby then and the fetus against COVID-19 infection. And we really recommend that all pregnant women, all recently pregnant women, all women who plan to fall pregnant, everyone trying to fall pregnant, who might get pregnant in the future, should be immunized and should really undergo the COVID-19 vaccination. It's really important to understand that pregnant and recently pregnant women are more likely to get severely ill with COVID-19 compared to non-pregnant women. I can tell you today that pregnant women with severe COVID-19 infection are almost twice as many admitted in our ICUs than non-pregnant women being admitted in ICU.
Okay, sure. That's very good to hear. And from a parent point of view, as a parent, we take our children, at the different milestones to get specific immunizations for diseases like chickenpox, measles, whatever. Are there similarities between those vaccines and the COVID-19 vaccine?
Now, Lucy, firstly, I think it's important for people to understand that we get different types of vaccines and it works in different ways to offer protection. We all know that some of these vaccines are live weakened vaccines. So it means it's a weakened form of the germ or the virus. And for instance, those are the chickenpox and the measles vaccines. Then we get the inactivated vaccines. It's actually a live, it's a killed vaccine, a killed germ or virus that we immunize with. And then we also get other types where we use specific pieces or even the toxin of a germ or a virus and make a vaccine of that, for example, hepatitis B and tetanus. Now, this new mRNA vaccine is just vaccine technology that scientists can now use through research, can use to make a new vaccine through new technology. So we also need to embrace technology. As you see, there are different types of vaccines, and this is another type of a vaccine. But what is really important, as with all types of vaccines, the body is left then with a supply of memory T lymphocytes as well as B lymphocytes that will remember how to fight that virus or germ once we are infected with it in future. It takes time to develop these antibodies and these memory cells before we are protected against the infection. And sometimes we even have to get a second or a third injection of the same vaccine. So researchers will now find the best type of vaccine to bring about the best protection against a virus or a germ. And this is where we are now. We even now looking at better ways to be protected against these infections and all new viral and germs that will surface and will arrive on our horizon and also have a huge impact on our society and our livelihood and our lives.
Okay. I hear that you and your husband both recently had COVID-19 despite being vaccinated with the COVID-19 vaccine. Would you like to tell us more about that?
Well, yes, unfortunately, I have to tell you, yes, that's true. We are both doctors working with patients and get exposed to COVID-19 infected patients in the consulting room as well as in the hospital. The good news is that both of us made a full recovery from this COVID-19 disease and we were not hospitalized. It's important to understand, although the vaccine provides excellent protection, they are not 100% effective. There are still very high levels of the virus that causes COVID-19 circulating in many communities in our country and all over the world, and especially with an increasing proportion being the variants of concern. So since you've been vaccinated, you are less likely to become severely ill with COVID-19, but there's still a chance to get infected and become infected with the virus and pass it on to others. So it's important that we all need to continue to reduce the transmission and protect each other through immunization and other measures.
So, what do you think would have happened to you and your husband had you caught COVID and not being vaccinated? How do you think that could have turned out?
Lucy, if I can tell you, honestly, I don't even want to visit that thought of not being vaccinated. You know, so many people our age had been admitted with severe COVID-19 disease. Today, some of them are still battling with lung damage, brain fog, long COVID, and the horrifying memories of sick people around you in the hospital fighting to breathe or even dying. This vaccine prompts our bodies to build T lymphocytes and B lymphocytes, and I keep on saying the same thing, that will remember how to fight the virus if we are infected in future, saving lives and keeping almost every vaccinated person out of ICU or dying. We know that the more South Africans get the vaccine, the safer we all will be. I think what's also important for me to tell you today is the sooner we will be able to go to the movies and gigs, if we get all these immunizations against COVID, we will also be having home parties. We can enjoy sports events again. We can see our borders opening so that we can travel again. And to all the runners and the walkers out there, park runs and marathons. You can always stay at home if you want to, but if you really want to go out, enjoy life again, do things, and please think about this. Get that immunization. And all, you know, we say immunization, vaccination, we go and we use those words. It's exactly the same thing, immunization, vaccination. And I just want to quote John F. Kennedy. And he said, and this is a very famous quote, I think it's so applicable here, one person can make a difference, and everyone should try.
Very true, very true. So I think if people who listen to you don't change their minds about going to get vaccinated, then I don't know what will, because you've certainly assisted a lot by answering some questions that people didn't know who to ask, because we tend to turn to social media for answers, and we think that must be true because so and so said it. So it's very good to get it from a medical professional who has knowledge about these things, so that we're not just operating from a place of fear, but from a place of knowledge. Yeah, so thank you so much. This has been very beneficial, Dr. Hanlie. We really appreciate your time.
Thank you, Busi. Thank you for your time as well.
Awesome. Thank you.